open. the highlights from last night. Good morning, everyone. As was previously announced, Governor Scott is not participating in today's press conference in deference to the fact that it is Election Day and his sensitivity to media concerns covering this news conference if a candidate was participating. I'm Julie Moore, the Secretary of Natural Resources, and I'm going to kick things off this morning talking about school-based winter sports and the guidelines that will be available later this afternoon on the Agency of Education's website. Deputy Secretary of Commerce Ted Brady will then continue and outline guidelines for the operations of our ski areas this winter. And then, because it's Tuesday, Ted will be followed by Commissioner Pichak with his weekly update of modeled COVID trends and the travel map, and then the health update from Dr. Levine. As with school-based fall sports, things will look different this winter. School-based winter sports typically offered in Vermont include Nordic skiing, downhill skiing, snowboarding, basketball, bowling, competitive cheer, dance, gymnastics, hockey, indoor track, and wrestling. Fully appreciating the important physical and mental health benefits school-based sports provide to our student athletes, supporting in-person instruction remains the priority. And as we continue to see clear evidence of just how fragile this can be, with growing case counts and positivity rates, both regionally and also here in Vermont, we are taking necessary precautions. The guidance presents an appropriately cautious approach and was developed with input from health experts and educators, as well as reviewed by the Department of Health and Agency of Education. We know that the risk associated with different types of sports programs is a function of the degree of contact between the participants and the type of setting or format in which the contest is held. Because of this, we were unable to identify ways to sufficiently mitigate the risk for two sports this winter and concluded there simply isn't a way to offer wrestling or indoor track. In addition, because of the increased risk of transmission associated with vocalization, cheerleading squads may not perform vocal routines in practice sessions or competitions during the winter 2021 season. Further, recognizing that gathering indoors inherently presents more health risks than outdoor events, and that schools continue efforts to minimize any visitors to their buildings, the guidance establishes that spectators will not be allowed at school-based indoor sports events, practices, or games this winter. This includes basketball, bowling, competitive cheer, dance, gymnastics, and hockey. We recognize this will come as a disappointment to parents and fans of local teams, but minimizing the number of people present is essential to appropriately manage the risk associated with indoor sports events. The masking mandate that was put in place this fall for all players and staff is going to be continued and extended to referees and officials for indoor sports events. The guidance establishes that winter sports practices may begin on or after November 30th, and that teams may initiate interscholastic games, meets, and competitions no earlier than January 11th, 2021. Providing 6 weeks between the start of practice and the first games is intentional, allowing time for health officials to look for any trends that may emerge and make further adjustments if and as needed. I want to be upfront in highlighting that should data emerge that indicates COVID-19 transmission as a result of sports-related activities, this could result in further delaying or suspending games, practices, meets, and competitions. And finally, as we've seen both locally and in case studies from across the country, COVID transmission often occurs during team-based social gatherings as opposed to the athletic event itself. While team-based social events are often considered an integral part of sports programs, in the interest of reducing preventable transmission, the guidance strongly discourages any such in-person team-based social gatherings this winter. And on a more personal note, as a mother of 2 teenagers, both of whom played soccer this fall, I take seriously the need to do what we can to provide a sense of normalcy in these far from normal times. The guidance represents dozens and dozens of hours of collective work in balancing the health risks associated with COVID against the benefits, the very real benefits, mental and physical, of sporting opportunities for our youth. And with that, I will turn it over to Deputy Secretary Brady to talk about ski area guidelines.
Thanks so much, Secretary Moore. Snow is on the ground today, so of course it's time to talk about skiing. So today, the Agency of Commerce and Community Development will be, actually already has updated our WorkSafe guidance, which is available at accd.vermont.gov, also at vermontvacations.com, to include a new section on Vermont Ski Resort COVID-19 winter operations guidance. The guidance we're issuing today aims to provide skiers and riders with the safest skiing and riding experience in the country. It aims to ensure the health and safety of the thousands of Vermonters who work in the industry at the mountains, and perhaps most importantly, it aims to protect the health and safety of the communities that host these mountains. Over the past 2 months, ACCD, the Agency of Commerce, the Department of Health, the Vermont Department of Public Safety, the Vermont Agency of Natural Resources with Secretary Moore's leadership, and others worked to develop this guidance. The end result is what I believe to be the safest and the strongest ski area guidance in the country. The guidance, as Secretary Moore just said about winter sports guidance, it requires people to do things differently. It requires the ski areas to considerably alter how they're going to do business this winter. In addition to following all of the existing health and safety measures in the WorkSafe guidance, ski areas have another layer. So let's be clear, without this guidance, we believe ski areas could have opened under the less restrictive WorkSafe guidance. Today, we're announcing a new layer of security and safety for Vermonters. So what's in it? What's in the guidance? There are several, I'll say 6 specific areas that add additional layers of safety for the skier, for the workers, and for Vermonters. One, and this is an enormous undertaking. The guidance requires all customers to attest that they comply with the safe travel and quarantine guidance when they show up at a resort. So when you go to a resort this year, much like going to a hotel currently, you're going to have to attest that you read, understand, and most importantly, comply with the state's existing travel guidance. 2, another big layer of safety. Ski areas are going to be collecting and maintaining contact tracing information for every guest that's on the mountain every day, and be able to give that information to the Department of Health in the event of a contact tracing need. 3, we're directing ski areas to reduce the reliance on out-of-state staff. So when you think about weekend warriors that come up to do ski patrol or ski instruction, that commute up from more areas in southern New England and New York, we're asking ski areas to reduce the number of people they rely on to do that. Ski areas are already doing this. They're already trying to reduce the number of people that they need to bring from out of state. But this guidance clearly says they have to. 4, lift operations will look different. In addition to managing lift lines a little differently, where you're not elbow to elbow and shoulder to shoulder, they're going to have to reduce the capacity of lift. The new guidance directs ski areas to reduce lift capacity to 50%, except for a party traveling together. So let's be clear, if you're a family of 4 and you're skiing together, you can get on a quad together. But if you're a twosome or a single, you're not going to be riding that lift with anybody else likely. Enclosed lifts, like gondolas, they're only going to be able to serve a single party unless the gondola is big enough, or the bubble lift is big enough, to ensure 6 feet between customers and guests. I think a good example of this would be the famous J Peak tram. That tram could hold multiple parties in there, and those parties could be 6 feet apart. 5, it clarifies guidance on base lodges. I think Vermonters know that we have some beautiful base lodges, places that are comfortable, great places to warm up and get a cup of cocoa. The guidance clearly says that ski areas need to reduce day-use lodges to 50% fire occupancy, with a maximum of 75 people in any one unique space, no matter how big that one unique space is. So again, 50% fire occupancy or a maximum of 75 people in that space. And then finally, the final thing I want to really highlight is that we've worked with the ski areas to ensure that they're offering very lenient cancellation policies to discourage guests who are sick or those impacted by a change in the state's travel policy from coming to Vermont because they're going to lose a few $1,000s if they don't. Today's ski area guidance will mean skiing and riding will look different. There is no doubt about it. In addition to 6 steps, we have about a 10-page guidance document at accd.vermont.gov, and you can see it at vermontvacation.com also. I need to be clear that this is going to take a lot of preparation and adaptation by both the ski areas and the guests of the ski areas. That's one of the reasons why the governor and the Agency of Commerce and the legislature worked together to dedicate $2.5 million in ski area safety recreation grants to help ski areas implement safety improvements to their resorts. In light of the fact that we just announced the guidance today, the agency has extended the deadline for that grant program from last week to the end of this week. And ski areas can apply for costs to make safety improvements. I also want to point out that more than a dozen resorts have also taken advantage of the Economic Recovery Grant Program that the Agency of Commerce is running to replace lost revenue. As I said before, the state worked hard to come up with this guidance, but I want to thank the Vermont Ski Areas Association for working with the state to develop the guidance, and especially the president of the Vermont Ski Area Association, Molly Mahar, who has proactively come to us and said, here are some suggestions, what do you think, and worked with us as we went back and forth. Since last spring, it's important to know that our resorts have put Vermont first repeatedly. They voluntarily closed when this pandemic began in March. They put restrictive rules in place over the summer to operate safely, which is worth noting, we did not have major problems at the ski resorts this summer or this fall. And they were operating everything from mountain biking to mountain coasters to leaf-peeping chairlift rides. And the ski areas are proactively, approaching us with a framework. I also want to point out that our resorts have already started changing the way they're doing things. Look at Killington. Killington has prided itself for decades on being the first to open and the last to close. They made a strategic decision this year to wait to open until they had enough terrain and enough lifts operating to spread that crowd over their mountains. There are ski areas around the state that are putting in novel, innovative ideas, such as Fulton, where they're offering ski cabanas so that people don't crowd into the lodge, or ski areas that have eliminated group lessons so that you have a private lesson setting only. Before closing, I want to point out that the Vermont Department of Tourism and Marketing is going to work cooperatively with the ski areas to educate those who love to play in the Green Mountains how to do so safely. We're asking skiers and riders to know before you go. Visitors should visit vermontvacation.com to know how to visit Vermont safely and read the most up-to-date travel guidance. I need to be crystal clear. Our travel guidance is not a suggestion. Our travel guidance is not an idea. Our travel guidance is mandatory restrictions that say you can only come to Vermont if you do these certain things. All skiers and riders are going to have to alter their routines. As Ski Vermont has said already, maybe you want to bring a sandwich this year. Maybe you want to boot up in your car. Maybe you want to make sure you're not skiing alone. Remember, if a lot of singles show up at the ski area, you're going to have a lot of quads with single riders on them. That's going to create prolonged lift lines. Most importantly, stay home if you're sick. Finally, skiing and riding may look different this year. Our guidance aims to do what Vermont's always done best, provide an unparalleled winter experience. In addition to having the best snow, the best resorts, the best free skiing, this year Vermont is going to have the safest skiing and riding season in the country because of this guidance and the cooperation of our ski resorts. We're creating an experience that's safe and healthy for both those on the mountain and, even more importantly, those off the mountain. Thank you, Secretary Moore. I hand it back to you.
Thank you, Ted. I'll now turn the podium over to Commissioner Pichek, who will present the COVID-19 modeled trends as well as the updated travel map.
Thank you very much, Secretary Moore, and good morning, everybody. As always, you can find our DFR presentations at dfr.vermont.gov, including today's presentation and all past presentations as well. Looking at our first slide, we're looking at new case growth across the country. You can see the story is pretty similar as it has been the last few weeks. We see a clearly defined third peak across the country. You can notice that back in the spring, we had about 32,000 new cases per day across the country. In the summer, when we saw the resurgence, that was about 67,000 per day. Now we're approaching close to 85,000 per day on a 7-day average. So that number continues to rise, and it is not showing any signs at the moment of slowing down. On the next slide, you can see where these cases are spread out across the country. Again, geographically, they're more diverse than they were previously. You can see from a week-to-week comparison that we have more cases in places like Utah and Michigan, and even in the Northeast as well. But generally, the story here is that cases are spread out more broadly. Looking a little closer to home in the region, you can see that new case growth is up 23% week over week. We now have 40,000 cases in the region. So again, we're seeing regional increases as well. When we look to all of the other regions across the country, the West, the Midwest, the South, and then also the Northeast, you can see even though we are continuing to increase and increasing at 23%, the rest of the country, the rest of the regions are seeing greater increases than we are in the Northeast. So similar to the summer, similar to the fall, cases are going up everywhere, but they're going up more slowly in the Northeast, even though they're going up more quickly when we compare ourselves to our own experience earlier in the pandemic. Now I want to show on the next slide a time lapse of our travel map. We just saw that cases in the region are going up, therefore that's obviously impacting our travel map. This is something that will be or is available on our website as well for anyone that's interested in seeing it. But you can see here on the first slide, June 26th, this is the first day that we expanded the travel map to include all of the current states that are in the travel map. You'll notice there are a lot of parts of the region, particularly more rural parts of the region in Ohio and in West Virginia and Virginia, in New York and Pennsylvania, that had a lot of green, and most of the cases were bunched up in more urban areas. If we time lapse through now, the summer and into September, into July 31st rather, you'll see that the travel map already started to change quite dramatically. Those places in Ohio and Virginia and places in Pennsylvania that got swept up with that summer surge quickly turned red and yellow. The number of people that could come to Vermont went from 19 million down to 4.8 million. So again, largely the Northeast was spared from this increase, but certainly that Mid-Atlantic and that Midwest area saw quite a dramatic hit. Now if we fast forward to September 11th, right at the beginning of the fall season, you'll see that there was some slight improvement. We went up to 5.5 million, and we were looking generally good heading into the fall weather. The Northeast looked relatively strong. The Mid-Atlantic, the Midwest could not quite shake the cases that they saw from the summer. They continue to be red and yellow. But again, things changed quite dramatically when we now fast forward through today. You can see that today there is essentially red and yellow everywhere across our travel map. It's on our borders. It's even in Vermont. 11 of our own 14 counties are above the current threshold for Vermont. That's something that's unique as well. Generally, in past times, we might have had a county or two over our threshold, but now it's quite clear that the cases are in the Northeast. You can see it on the map. You can see that they're on our borders, and you can see that cases are going up even when comparing within the Vermont borders as well. All of that boils down to the fact that we only had 2 counties move to green this past week, while 13 moved to red or yellow. That nets out at a decrease of about 500,000 people that are no longer eligible to come into Vermont without a quarantine, bringing the travel map number down to 332,000. So obviously this is the lowest the travel map has been since we published it, and it's down quite considerably from that 19 million number that we started with on June 26th. So quite a bit of change, obviously, throughout the summer, but more importantly, quite a bit of change in the fall as it relates to the Northeast and Vermont. Talking more specifically about Vermont, we do want to highlight just a few things, because our case counts have stayed higher, but there have been some improvements. We had 132 new cases reported this week. We showed this slide last week with the 3 different peaks in Vermont. You will notice that now playing it out for another week, that peak that we saw last week that really was on the rise and you weren't quite sure what was going to happen to it, it has at least slowed down, and you can see it sort of cresting down. We don't know if that, obviously, even in the short or long term, is going to stay in that trajectory, but it is good to see that that has crested, at least for now. And then when we compare that to New Hampshire and to Maine on the next slide, you can see that that's not the story that they're experiencing right now. Last week, they were seeing case increases, and those cases have continued to increase this week. Both New Hampshire and Maine, on a 7-day average, are having more cases now than they did at any other point during the pandemic. So in terms of the Vermont news, this changed our forecast. If you remember last week, the forecast was quite dramatically different because we had seen such dramatic case growth, and cases did seem to be trending up. Because they're more stable in the last week, even though they're more elevated, the forecast has improved. It shows that we should have a slower level of growth over the next 3 to 6 weeks, peaking at about 40 cases a day. But again, just as we said last week, this can change based on Vermonters' behavior, both for the good and for the worse. So we certainly want Vermonters to continue all the good public health protocols that are in place. Looking ahead on the week-over-week comparison across Vermont, the only thing we wanted to point out was that Coos County in northern New Hampshire has been seeing a dramatic increase in cases. In Vermont, we saw 4 cases in Essex County, a very small county for us, and we've never had that many cases reported there in 1 week. So maybe there is some spillover from what's happening in New Hampshire. That's obviously a community that's quite, it's one community in some of those places up there in the Northeast Kingdom. So just a reminder for those that live in the Northeast Kingdom to be careful and cautious about traveling to that part of New Hampshire now, whether for essential or non-essential reasons. Now, again, all of this put into context, even though cases continue to be on the rise across the country, in the region, and to some degree in Vermont, things like hospitalizations and deaths remain very low. You'll see here in Vermont that we had a slight uptick, although it's pretty minor, and we've had similar upticks in other parts of the summer in terms of our hospitalization and ICU usage. So nothing that really stands out for concern. And then when we compare that to ourselves, to the national average, and to northern New England, you can see just how good shape we are here in Vermont compared to the national average. You can see hospitalizations are going up nationally, but in Vermont, they're pretty minuscule, and this is on a per capita basis. And northern New England as a whole is performing quite well on this metric. Similarly, when you look at fatalities, those are going up nationally, but again, in northern New England and particularly in Vermont, those remain very low, fortunately. On the next slide, you'll see that in fact this week, for the first time, we can confidently say that we have the lowest fatality rate in the country since the start of the pandemic. Again, obviously good news from that perspective. So it's not all bad news in terms of what's happening in northern New England and Vermont, but it is certainly cause for concern when you see cases rising, because that's a leading indicator. Hospital and deaths, unfortunately, are sort of a lagging indicator in terms of the result that you might see from those case growth. In terms of the restart metrics, we'll just mention they're all trending favorably. There's no need to call out one in particular. I'll just mention, though, that in terms of positivity, we do remain to have the lowest positivity rate in the country. So again, everywhere is seeing some impact from the spread of the virus. We're seeing it here in Vermont, but we continue to stand out when compared to our peers locally and nationally as well. Just a couple of other updates on flu data. You'll see that we just got over 150,000 Vermonters vaccinated as of last week. We are about 50% to our goal for vaccination, so we continue to see a good uptick in the flu vaccine. I want to encourage everyone to still get their vaccine. Everyone that can avoid getting the flu, avoid spreading it to someone else, avoid a hospitalization will be helpful to all of us as we enter into the later fall and winter potential surge for COVID-19. Last, on the K through 12 and higher ed update, you'll see that Vermont added about 14 cases to its K through 12 case count this past week. New Hampshire added about 55 cases. Maine 23 cases. So we continue to trend favorably when compared to the rest of northern New England. And then last, when we look at the higher ed numbers, Vermont added 36 new cases this week, most of those associated with St. Michael's College. Beyond St. Michael's College, the numbers are really stable in the higher education space. So with that, I'm going to turn it over to Dr. Levine.
Thank you. I'll start off by saying I hope everybody had a happy Halloween. I was glad to see and hear about all the creative ways Vermonters found to trick or treat safely. From Halloween-themed face masks to decorated tables and candy slides, Vermonters showed they understand how to protect each other. We can follow the guidance and still have fun. Some of those ideas may even become a more permanent part of our Halloween traditions. Let's all keep that creativity in mind as we navigate the coming months of the pandemic. The kids in our neighborhood said it was one of the best Halloweens ever, and their parents said the same. Everyone was at the end of their driveways, physically distanced across tables and decorations, but very socially connected. Now I also know that some people may have had different Halloween celebrations. Maybe what was supposed to be a small gathering was a little more crowded than you expected, or maybe you just slipped and ended up in a riskier situation at a party or in a bar. If that's the case, I'm not here to yell at you. We're all human. But please know that it's not too late to protect people around you. Consider staying closer to home for a while and avoid seeing anyone who's at higher risk of COVID-19. And after 7 days have passed, it's a good idea to get tested. So you might want to plan that out now. As much as we want to avoid these kinds of high-risk situations, they are going to happen. And the more we can acknowledge them, the greater chance we have of stopping any potential spread of the virus. Speaking of higher risk, let's return again to that travel map that we just saw. I know that a sea of red isn't what any of us want to see right now. We are tired of this pandemic. Maybe we're just trying to tune out the bad news now. We miss our family and friends, and we just want to look ahead to joyful holiday traditions together. But unfortunately, as the map tells us, we need to face the reality of our current situation. The latest surge of coronavirus cases is hitting many parts of the country, including the Northeast. We're seeing a rollback of reopening plans, restrictions being imposed in various states. Here in Vermont, we continue to see more cases reported every day and growing numbers of small outbreaks. As I've said before, Vermont is not safe from COVID-19. It's our job to keep each other as safe as we can. That's why, as we make our holiday plans, it's probably a good idea to avoid travel if you can. Travel will increase your chance of getting and spreading COVID-19. That same message applies to any visitors you may be inviting to your home who come from outside of Vermont. Those visitors would need to quarantine in your home, including your returning college student. I want to emphasize that quarantining in someone else's home does not just mean you can't go out to the store. If your guests are in quarantine, they should wear a mask in common places, use a separate bathroom, eat separately. That's really important to note if a Thanksgiving meal is being planned. Stay 6 feet apart and otherwise not be in close contact with other household members. You can find more information like this on our newly updated webpage regarding isolation and quarantine. Without taking these steps, you could easily be exposed to COVID by one of your visitors who unknowingly brought the virus into your home because they didn't know they were infected and might be in their pre-symptomatic period. If you do leave Vermont, remember that you need to quarantine for 14 days when you return, so plan ahead. Of course, you can also get a negative test after 7 days and quarantine early if you have no symptoms. End your quarantine early. We know that social gatherings, often among trusted family and friends, are a driving force behind much of the virus's spread right now across the nation. Adding the element of travel to the mix only adds to the risk. Celebrating the holidays at home will be different for many people this year, but maybe like Halloween, we can come up with some new holiday traditions and innovations. Maybe even a few we'll want to keep. And we can be thankful we're all doing our part to protect one another. Since today is Election Day, if you haven't voted yet, you can still drop your ballot off or vote in person safely, as all voting sites through Vermont have integrated specific public health guidance into their protocols this year. Now to move to cases and outbreaks. We continue to see daily totals of cases in the teens and 20s. Some days, though, heavily influenced by our ongoing Central Vermont hockey outbreak, or as it has become to be called, though more accurately, Ice Sports Teams, Washington County. As of last night, there were a total of 112 cases. I've noted previously there were 6 schools that had in some small way been impacted beyond the Union Elementary School. We told you we'd report on which schools they were, and they were South Burlington High School, Williston Central School, Francis C. Richmond Middle School, Barry Elementary, Montpelier High School, and Oxbow High School. But the major impact from this outbreak, of course, currently has, of course, been St. Michael's College. The total count there is now 65, 17 having been reported yesterday after campus-wide testing. Fortunately, the majority of cases on this campus have been asymptomatic. The campus remains on remote learning. Now we can move on to the question period.
All right, just a reminder for everybody, the governor is not here. We do have our subject matter experts here, but please keep the questions in their wheelhouses. We'll start with Calvin.
Thank you. So I just have a quick clarifying question about the ski guidance. I know some individual resorts were doing reservations. Is the state going to be requiring reservations ahead of time, or can I just show up to the ski slopes and ski?
Sure, I think that one's my way, February, summer. The guidance does not require a reservation system for skiers. So some resorts have implemented those, and basically we're telling resorts, here's the guidelines that you need to operate within to reduce capacity in your lodges, on your lifts, and other places. And ski resorts are going to take different approaches to meet that guidance. So no, there is no state requirement that you have to have a reservation before you go to a ski resort. You're going to want to check with your resort ahead of time to see what policies that resort is putting in place to comply with our guidance.
And I guess a quick follow-up too, I mean, there's lots of red counties around. How are we going to make sure that people are actually following the quarantine rules, right? I mean, we've already heard from some owners of hotels and B&Bs over the summer that there were, visitors that they were basically lying on the honor form. So I'm just wondering how we'd enforce that.
Sure. Well, one, we need to do a big education campaign. And the Department of Tourism is working with the CRF marketing money that was afforded to it by the legislature and the governor asked for. And we're going to be doing a lot of marketing to make sure people know what our travel policy is. That's the number one thing. Two, the ski areas are doing the same. In addition to an educational campaign, they're also requiring when you buy your ticket that you attest that you have read and understand and comply with the state's travel guidance. This is the most restrictive policy in the country when it comes to, the resort interaction with the skier. So we're putting in place a level of protection that other states are not. In addition to that, we're asking ski areas to hold skiers accountable, so that if skiers don't do this, they have to be sent back, but also that there are ramifications for not doing that. The existing guidance specifically speaks to that, saying that your skiing and riding privileges could be revoked if you violate the state's travel guide.
And then just one follow-up as well, where it's school guidance. You mentioned that the state is highly discouraging gatherings off the ice and off the court. I'm wondering if there will be any disciplinary action, if that's in the guidance or if that's something that the district has to determine.
So the Vermont Principals Association, the VPA, is going to be issuing a companion guidance document with a lot more details on their expectations around conduct for teams. I expect that guidance document will be released later this week. You're welcome.
Zuri?
Dr. Levine, what do you say to people who are kind of frustrated right now with the quarantine rules? I mean, you guys have said this is one of the most restrictive in the country. So what do you have to say to people who are a little bit frustrated with the rules right now?
Let me be clear, the thing that's most restrictive is what Deputy Secretary Brady was talking about with regard to the policy around the ski industry's interaction with the customer and the need for quarantine. But quarantine as a public health measure is pretty standard around the country. And just so I can reassure Vermonters, we're actually on the more progressive side, if I could use that word, because we do provide this opportunity to test out on day 7 of what otherwise would be a 14-day quarantine. And if you add in the couple of days that it might take to get your test result back, you're still significantly shorter time than 14 days. So it's a pretty progressive policy that has really stood up over time very well here in Vermont and allowed a lot of people a lot more freedom without endangering anybody in the population in terms of new disease exposure.
Thank you.
Steve?
This is kind of self-serving, I guess, but in the school sports guidance, I can imagine there's going to be a lot of pushback a little bit on the parents' side not being able to attend games and things like that. What about covering these games for us?
So we are looking at what opportunities and tools there might be available to promote broadcasting games online, on TV, or even on the radio. I know that some local access channels have been providing that service throughout the fall because there have been limitations on the number of spectators allowed to attend games. And we're looking right now at ways we might be able to bolster and further support that sort of activity.
Thanks.
You're welcome.
Moving to the phones, we'll start with Lisa from the AP.
Thank you. And this is a question for Ted Brady. Do you know how Vermont's ski policy compares to New Hampshire and Maine? And if there are major differences?
Sure, there are major differences. So perhaps the most notable is the base lodge area and the requirements to have a capped number to be in line with our social distancing. Our maximum gathering size is 75. That's perhaps the most notable. But also, as I said before, neither of the other states is requiring this attestation that people are meeting the travel guidance, and our lift guidance is a little different. The capacity restrictions in our lift guidance is a little more restrictive.
Okay, thank you.
All right, Lisa Loomis, the Valley Reporter.
Good morning. My question is also about the ski resort attestation. The resorts must require guests to attest that they're in compliance with the state's travel policies for point-of-sale tickets and when purchasing a pass. Why are only ski resorts and lodging establishments required to do this when restaurants, retail shops, grocery stores, and others face no similar requirements?
Sure. Well, first let's realize that the hospitality sector has been the most impacted sector of this crisis, as the governor said again and again. And that's why we've stood up these economic recovery grant programs to recognize that. We also recognize the hospitality sector and the ski resorts are in the unique position of drawing a lot of people to Vermont. And it is the place where out-of-staters interact with other Vermonters. So it makes sense that these are the places where we put these additional travel safety measures in place, because we know these are the places where travelers come to. We know these are the places where we can interact with that traveler, educate that traveler, and make sure that traveler is in fact complying with our guidance. So the obvious reason is this is where out-of-staters go, so we're catching them at the point of contact when they come here to the state.
And then as a follow-up, can resorts legally suspend or cancel people's passes? In particular, if the attestation requirement was not in place when they were purchased. Many people purchased their ski passes last spring, this summer, or earlier this fall before this requirement existed. Does this have teeth?
Sure. Well, I think, I certainly think it does. Ski resorts have the right to suspend service to people who violate a whole host of rules, whether you're skiing out of bounds or skiing unsafely, or as we've seen in past circumstances, poor behavior that's not conducive to a resort operating safely. It's safe to say that if you violate our travel policy, you're putting Vermonters at risk, you're putting the people that work at the ski area at risk, and you're putting our communities at risk. So we certainly believe that this you could suspend somebody's right to ski and ride based on an unsafe behavior.
Thank you.
Kat, WCAX.
Good morning. We've had 464 cases in the past month, which is 21% of all the COVID cases that we've had since the start of the pandemic. And in just the past 2 weeks, we've had 273 cases, which is 12% of all the cases since the pandemic started, and 136 of those were in the past 7 days alone. At what point do you become alarmed by the rising numbers, and what is the benchmark for implementing new restrictions? What's the number on that?
Hi, Kat, Dr. Levine here. Thanks for those questions. Numbers of that magnitude in Vermont always pique our interest, needless to say. I don't want to use the word alarmed, because such a substantial proportion of those numbers that you just recited are with this one major outbreak. We went through a similar experience, as you saw on the graph, with that sort of second peak that we had on our curve, which was the Burlington-Winooski outbreak that had well over 100 people in it as well. The nice downslope that Commissioner Pichak just showed us at the end of the graph hopefully will be the beginning of a trend, because we actually are not seeing a lot of spread of this Central Vermont ice sports teams outbreak in other sectors. It's mainly limited to the St. Michael's College now, and there are great measures instituted on this campus to make sure that those numbers don't grow substantially more. So we would hope that when that outbreak itself tails off and comes to an end, we'll see much more of what we expect to see, which is an increase in cases over where we've been over the summer, but not an increase to the degree we've experienced that you just mentioned in the last several weeks. That's where I would hope, in an optimistic frame, we would settle out. Now, with regard to your second question about what would push us to do more, one thing would push us would be if any of those four metrics that Commissioner Pichak appropriately kind of brushed over today, because they're not alarmingly changing in any one way. We still have the lowest positivity rate. Our hospitalizations went up a little notch, and that's it. So, you know, and the other two metrics likewise. So they're not approaching the so-called guardrails that we would be concerned about. That's one thing. But there's part of this game that isn't just reacting to data, it's being proactive. And we want to be exceedingly proactive. The ski guidance that we've just been hearing a lot of questions about and discussion on is a great example of that. It's like, we need to open the ski industry, we want to. People will need that for their physical and mental health. People will want to be outdoors in the winter doing something like that, and there is a way to do it. However, the way to do it is not the way we've done it every year for the last century. It's going to be a very novel way, just like Halloween was different this year. So we try to be proactive with that guidance to be an example, if you will, of the kinds of things we want to watch out for. And the things we want to watch out for, which I've messaged a little bit today, are an inordinate degree of travel that would not involve quarantine, because pretty much you've seen the map, all travel involves quarantine at this point. And the other thing would be the size of gatherings, because we know that this virus thrives when people are close together in crowded settings, and add to that questions about ventilation, and it would be even worse. So that's the science behind the virus and the kinds of guidance that we're proactively talking about here today. But nothing further than that, if you're thinking, because again, none of our guardrails are really being approached, and the data doesn't support us getting super aggressive as a reaction to the recent increase in cases.
And I'll just ask a very quick follow-up then. You're confident that those 4 guardrails are the 4 metrics the state needs to look at to be confident that rising cases are not a concern?
They're the fundamental 4. We actually look at more than that, but we certainly want to respect those the most. I think in a hierarchy of guardrails, and if Commissioner Pichuk wants to say any more, he can, but it's really a hierarchy of guardrails. Those are the 4 that are the most critical for us to watch. But again, we want to be preemptive and proactive too. So sometimes without a guardrail, we'll do something like you just heard with the ski industry, which is more restrictive than it's been in the past, but I think passes its reasonable test to most observers.
Thank you.
Tim, Vermont Business Magazine.
Hi, this is for Secretary Brady. I had a question about the capacity sizes of the ski resorts, not the food and beverage service. Ted, just to be clear, so the maximum inside a ski lodge would be 75 regardless of the fire capacity. Is that correct?
Close. It's 50% of your fire occupancy with no more than 75. So let's say that your fire occupancy is only 100. You could only have 55, even though we have that 75 upper limit. But if your fire capacity was 500, you could only have 75. Really important to know that most of our ski lodges, though, are not one single space. You might have a big space upstairs and a big space downstairs, and both of those would be considered unique individual spaces that you could have up to 75 in each.
The other question I had was, the ski areas are pretty much have pretty solid plans on their food and beverage services, and obviously very important to their economy, because we all know how much a sandwich of beer costs at a ski resort, frankly. If they have outdoor tent, heated tent, something like that, what is the procedure, what is the limitations on the capacity for those?
Sure, so it looks the same as the indoor spaces. So, when you have if you add additional space outside, put up a tent, you're likely going to have walls. The tent has walls, that's an indoor space, so you couldn't have more than 75 people with an asterisk of no more than 50% of your fire occupancy of that outdoor space. If a ski lodge is operating as a restaurant, so where they actually have table service, they should operate as that restaurant guidance. Takeout's a little bit of a different story. If it's a takeout meal, you could take it to one of your spaces, but the space needs to still be managed to no more than 50% occupancy and no more than 75 people per space.
Now, when the governor issued the original restaurant guidance, he allowed for basically cocktails to go. Would be that same sort of policy on the alcohol service?
I'm not familiar enough with what type of permits each of these ski resorts has, but yes, the restaurant guidance applies to a restaurant service. So if they have a liquor license and they're able to serve liquor, they'd be able to follow the same rules other restaurants could follow.
Okay, great, thanks.
Joe, the Barton Chronicle.
Hello, I think this is probably for Dr. Levine, but I've been wrong before. I know that well before the very large increase in the number of cases of COVID around the country, you were already predicting some kind of increase in Vermont just due to people coming indoors. I understand the spike in Washington County, you know, the causes of that, and similarly, the discussion earlier on suggested that there might be some spillover from Coos County into Essex County. But for the remainder of the increase in cases, do you see that as simply what you were expecting in the first place, or is that more reflective of the large-scale increase in the states around us, all of them? And in that case, does that suggest that people are not following the quarantine restrictions properly?
Yeah, so you've loaded a lot into that. So you're correct. We did predict there would be more cases as the fall and winterish weather made itself apparent because of people moving indoors. We do have some concerns on the part of the map that Commissioner Pichak showed from Essex County adjoining a hotter area in New Hampshire. And we also notice what's happening in the map in general, all the states around us, with significant increases in cases. Southern New England particularly, but even Maine and New Hampshire now are both reporting much different levels of caseloads than they have previously, with some attendant increase in hospitalizations as well. So lately what we've noticed in Vermont is that we have very small clusters, or when the cluster qualifies for an outbreak, outbreaks that might be occurring at a work site, at a daycare, at a healthcare facility, here and there, but very small numbers. I could use the word randomly, but not in a very coherent fashion. We do know that if you look at, for instance, all the cases over the course of a month, that we understand, for cases that we understand where there might have been an association, because about half of the cases it's hard to know, but where we do know, household contacts play the biggest role. And it's almost always family or roommates or extended family, much less likely small numbers, friends, things of that sort. And then second to that is travel. Sometimes there are multiple reasons, so it's hard to sort them out clearly. But that's sort of how it plays out recently. And again, the expectation was being indoors just provides more of an environment that the virus thrives in with regard to the drier weather, the ventilation, the tendency to be crowded, sometimes to not have a mask on if you're with familiar people, all of that. So those are the expectations for this kind of weather, this time of year, and I wouldn't expect that to change markedly. But again, it's a matter of trying not to let your guard down at every moment, because that one time you do could put you in the situation where you might actually contract the virus or endanger somebody else. Did I get to the crux of your question, Joe?
I think so. I have just one other follow-up, which is, given that 11 of Vermont's counties, if they weren't in Vermont, would be considered areas that one would need to quarantine if you visited, are there special additional precautions other than what you've been talking about before that people should take if they live in these areas?
No, I think the precautions apply no matter where you live, whether it's even in Vermont or outside Vermont. But certainly we only have control for what we as Vermonters do with inside Vermont. And again, there's a brilliant team taking care of this pandemic here, but I want to say that nothing we're telling Vermonters is rocket science. Stay home when you're sick, personal hygiene like hand washing, physical distancing but social connectivity, wearing masks, and not getting into crowded situations indoors. It really can be distilled down to that simple. And until we have more vaccine availability and we have another sort of quiver in our arrows here, in our bows, the fact is we need to follow these dual paths. Getting, hopefully, vaccines that are safe and effective approved, getting them into the state, starting to have uptake by the population. But while that's going on, everybody doing all the things I just said.
Thank you very much.
Thank you.
Next, we have Aaron at VT Digger.
Can you hear me okay?
Yes.
Okay. The CDC put out a guidance, I guess you could call it, saying that people with symptoms of COVID-19 or even people who are quarantined with the virus should still be able to go out and vote in person. I was wondering if Dr. Levine, if you had any thoughts on the safety of that. I did see that the Secretary of State's website published guidance saying if you have symptoms, stay at home and contact the town clerk before Election Day to arrange a ballot. But I don't know if you had any thoughts on that guidance versus what the CDC is saying.
Yeah, I was frankly myself a little surprised at the CDC guidance, but they're trying to do the right thing for the majority of people, some of whom might not avail themselves of the opportunity to vote if they didn't remove themselves from quarantine to do that. So what they're doing is saying essentially that the voting experience in 2020 has been made so public health aware and public health conscious and had so much guidance built in that if you abide by that, and they even said you can let people at the polling station know that you want to be sort of separate from other people, that you can actually continue to be distanced, continue to be masked, avoid being anywhere near a bunch of people and certainly not in a crowd, and kind of do your business and move on. That seemed to me, I guess, parsimonious may be the word. Certainly allowing people to go a little further than we usually guide them with quarantine, but making sure they understood that it was going to be as safe an experience as possible.
Yeah, would you compare it to the protests where, there were concerns about the size of gatherings, but people said, well, this is important for democracy, we can't, limit people's amendment rights?
Yeah, it's hard for me to compare it to that because here people are exercising their right to vote, there they're exercising their right to be in a protest, but putting yourself in a protest does endanger yourself and others who are in contact with you to a much greater degree because of the crowding and the inability to socially distance at all times, even though I know people wore masks pretty consistently. So that's a little bit higher risk and not as considerate of your fellow citizen, if you will, as what the CDC envisioned the voting experience would look like.
Yeah. I know with the protests, there was a lot of concern that they could become super spreader events. My understanding is that they didn't really pan out, but I mean, you could correct me on that if I'm wrong. But given what we're seeing now with the like online polls in other states and you know, the potential difficulties people are having with mail-in voting and the desire to vote in person, are you concerned these you know, basic functions of our democracy could become, unfortunately, spreader events?
Yeah, there's always a concern about that, but I think the fact that compliance with all of the basic guidance is part of the deal makes it much less likely. And if I could compare, for instance, the protests, where I really, you know, again, my guide is other state health officials and watching the television, everybody was really trying to stay distanced as they could and wearing a mask consistently. If I could contrast that with South Dakota and the Sturgis motorcycle event, where it's been now well proven that through God knows how many states, numerous cases have arisen from that event. That was at an event where people actually were completely discarding the public health guidance. There was no such thing as a physical distance. There was no such thing for many as masking. So they're very different kinds of experiences, and I guess it shows you that an outdoors event that's done well can actually not turn into a super spreader event, whereas one that is done poorly with little regard for compliance can become a disaster.
Okay, thank you very much. That's all.
Eric, the Times-Argus.
Yes, this is for Commissioner Shirley. Polls have been open for a few hours now. Any issues to report? Any voter intimidation? Anything? Any issues with people trying to vote?
Good afternoon. Thanks for the question. No, so far, knock on wood, all has been well as we anticipate here in Vermont. We're in consistent contact with agencies around the state and the Secretary of State's office, and so far, nothing to report.
Okay, thank you.
Avery, WCAX.
Dr. Levine, the American Society for Microbiology did a survey of various labs across the country, and they reported that there was a shortage of commercial test kits for COVID-19, as well as test kits for strep throat, pneumonia, bronchitis, some sexually transmitted infections. What have you been seeing in terms of the testing supplies, and how is it affecting Vermont?
Yeah, I haven't seen the exact survey you're referring to, but we are concerned actually about testing supplies for another area of public health, which is sexually transmitted infections. And we've actually just been sending out some guidance regarding that to the clinical community. But with regard to the COVID and other respiratory kind of pathogen testing, I know that has been a concern. We, as you know, have been adopting a policy internally of stockpiling as much as we can. The other policy we've had is diversifying the portfolio of test platforms we have throughout the state. And we've recently acquired for 5 of the hospitals across the state that did not have testing capacity, we've acquired Cepheid platforms for them for testing, and they're all undergoing installation and training as we speak right now. And we've also gotten from the manufacturer some assurance regarding a supply of the actual reagents that will be needed to manage that platform. So nothing alarming happening in Vermont at this point in time, but obviously we're always a little nervous about that based on what the country went through back in March, and we don't want that situation to arise again.
Thank you.
John, VPR.
Hello. I have a question about ski areas. It seems like looking at the travel map and listening to the guidance about ski areas, there's sort of a discordance here. The travel map would seem to indicate that only people from northern Maine and maybe a county in New York and maybe one in Pennsylvania can come here without quarantining. for 14 days or 7 days and getting a test. And the ski areas are hoping to have as much business as usual. But they draw from the places that are all in the red. Realistically, what kind of ski season based on out-of-state business can we expect? It's a huge industry, as you know, $1 billion in wages and almost $400 million in taxes in Vermont. And I'm wondering, really, I guess this is for Ted, how can the ski areas have these, or how can skiers follow this guidance and actually come here and ski?
Sure, thanks. The most important piece of this is that you're right, that people should be quarantining if they're coming from a red county before coming to Vermont. And that's a very real opportunity that Vermont affords people. You can quarantine at your home for 14 days or for 7 days in test, and then come straight to Vermont by personal vehicle. So despite the status of the travel map, there is a way to get here. It's worth the quarantine, folks. If you want to come to Vermont, it's worth working from home for a week. It's worth finding a way to come here. But we fully recognize that the travel policy is going to lead to less people being able to come here. And we expect ski areas to have a decreased customer count. If you look at a place like JP, they depend upon a plurality of their customers to cross the international border to come to their ski resort. That border's closed right now. Will it be closed in 2 months? I don't know for sure. When you look at places down in southern Vermont, those counties likely will be red for a little while or yellow. So we're asking people to plan ahead. If you want to come here for Christmas break, you need to quarantine before coming here. We recognize that ski areas are going to have a difficult year economically. That's why we've created the Economic Recovery Grant Program that gives up to $300,000 per business to replace lost revenue due to COVID-19. It's why we created the $2.5 million Ski Area Safety Grant Program. And that's not enough, but that's why we've done those programs, because the travel policies, the pandemic, is going to impact the bottom line of our ski areas. I will say that when we look at outdoor recreation across the country, it has boomed in the pandemic. Vermonters are hiking more, Vermonters are biking more, Vermonters are boating more. We think Vermonters will ski more. But this could be the year to take up skiing if you're a Vermonter.
And John, I might just ask
Sure.
Commissioner Pichek to just quickly just give a reminder about the travel map and how it changes weekly. It's not static. So that might be the full answer, but just a quick, just to your point about the question of the travel map this week and the ski season being a few more months.
Yeah, I think that's right. I mean, the ski resorts may open more, in the near future. I know the guidance is out and snow is on the ground, but the map obviously updates every week. We'll see what happens regionally. We've seen these peaks, really with rapid rises, and then people settle down, behavior changes, and they get things under control, and we do see improvements. So hopefully we see that in the Northeast. But, also, as Ted mentioned, quarantining before you come to Vermont is a real option as well.
And again, it's up to the ski resort to get the sort of affirmation from the visitor that he or she has done so. That's the enforcement on this.
Well, that's really the education and point of compliance, where we're going to ask people. And when, if there is ever an event that needs to be followed up on, we look to the ski areas to present those attestations. And if we find that somebody hasn't followed those attestations, there are repercussions. The most notable one in the existing guidance is the loss of skiing and riding privileges at that resort going forward.
Thank you.
Liz, the Burlington Free Press.
Hi there. I have a few questions on the ski guidance as well. My first question is, we've seen a couple of ski resorts put out their own, rules and regulations for the upcoming ski season. And one of them is, some of them are requiring reservations. I wonder if that's going to be required for all ski resorts, or if people can go to the mountain the same day.
Sure, the existing guidance does not require mountains to put reservation systems in place. It requires them to make the capacity reductions we talked about. Some of them have decided, and anticipated this, decided that a reservation policy is the best way, but no, it does not require a reservation policy.
I also wanted to ask about the attestation that people have read and understand the state's travel guidance when they sign up for a ticket. It kind of sounds to me like, the people who click the box that says they understand the terms and conditions for whatever they're signing up for. So I guess I wonder what the enforceability of that is, and whether you are anticipating that people will actually follow through and do that.
Yeah, we do anticipate people will actually say the truth and attest to the truth. This isn't a 10-page document. This isn't a real complicated thing. It says if you're from an area that has a high COVID case count, you need to quarantine before you came here, or you need to plan to quarantine when you get here. That's a lot simpler than the legalese that you read on those disclosures. As far as actual enforceability, yeah, part of this is an education campaign. Let's not pretend like everybody understands and goes to vermontvacation.com or accd.vermont.gov to learn about the travel policy. We need to educate people. And what better time to educate them than where they're about to make a purchase to come to Vermont, to ski in Vermont. We've put a real consequence of breaking that policy in the guidance, and we'll look to enforce it through that policy. This is a living document. If things get worse, our guidance is going to get stricter. If things get better, perhaps our guidance will get more relaxed. But right now, where we are today, given the state of the virus, this is the safest way for us to open ski resorts.
Thank you. I also have a question about the winter sports guidance. I wonder whether the experience from fall sports influenced any of the decisions for the winter sports guidance. Like, did things go according to that plan, and did the experience make the thought of having winter sports still more conceivable?
Certainly, for school-based fall sports, we think that overall they were highly successful. We know that athletes had concerns about some of the modifications that have been proposed, particularly for football and volleyball. But in the end, I think that those athletes that chose to participate had an enjoyable experience. We're also learning from our experiences related to recreational sports, in particular the Central Vermont outbreak that Dr. Levine referred to. As we move indoors with school-based sports, looking for ways to take some lessons learned and additional mitigation measures in an endeavor to ensure that those sport activities remain safe and that kids can remain in school.
Thank you.
Guy Page? Guy, Chronicle of the Vermont State House? All right, we'll move to Mike Donahue, the Islander.
This is a question for Ted Brady, I think. So, if somebody violates the rules and say gets kicked out of the snow, what's stopping them from moving down to Bolton or Sugarbush? Are the resorts going to be able to share the names of people that are violating the rules?
Sure, that's not contemplated in the guidance, largely because this is about educating people about what our travel policy is. So asking people to do the honorable thing and tell us whether or not they've complied. And then we do have an accountability measure in place Our problem is not going to be that a few people sneak through. Our problem is going to be if people don't understand what the expectation is, they can never live up to that expectation. When we're setting a crystal clear expectation, we're educating people about that expectation, and we're putting measures in place that can hold you accountable if you violate that expectation.
If they've invested a considerable amount of money to rent a condo and maybe rent skis, whatever, they aren't likely to want to give that up very quickly without taking another shot at another resort, I would assume.
Well, what we hope is that people will see our guidance, understand our guidance, and make plans around that. So, hey, this is a great time to start remote working from Vermont for the winter. This is a great time to look into Vermont real estate and move to Vermont, but we certainly understand people are making big investments. That's part of the reason we're requiring resorts to offer liberal cancellation policies. When you look through the resorts right now, you see so many of them have past protection plans that allow for a refund if the ski area can't operate or can't open, all of these things on those lines. But we can't account for every possibility, but I think we've done a pretty good job of trying to protect Vermonters and trying to protect the people that work at the ski areas and trying to provide a safe ski and riding experience in Vermont.
And the other question is, so I know that you're saying the resorts are being encouraged not to hire out-of-state workers, ski patrollers for the weekend, whatever. Did the state contemplate putting like a percentage on the number of out-of-state employees, like 10%, in an effort to really give guidance to the ski resorts, or are they realizing that they've got to operate and need people there? They're going to make a good faith effort, but the reality is they may end up with a considerable amount of out-of-state employees coming in.
Yeah, we've worked with the ski areas to identify how many they normally have coming in, and all of them have said we intend to reduce that number, period. So the goal here is to reduce the risk, and I think the existing policy that we just announced will reduce that risk. Where also the policy reminds people who are coming here to work, whether it's at ski areas or not, because our current travel guidance allows people to come to Vermont for authorized work without quarantining. If you're coming to work, that's what you're coming to do. You don't have an exemption to go socialize. You don't have an exemption to go to the bar. You don't have an exemption to go live it up in Vermont while you're here for work. And so that's another thing we're asking ski resorts to remind their employees. If you're coming up to patrol, which, let's be clear, a ski area cannot operate if it doesn't have the right amount of ski patrollers. They can't run the lifts. They can't provide the service they need to, and the resort couldn't open. So they're clearly essential workers. But when they're here doing essential work, we're saying, please, you need to step back and put Vermonters first. You've trained to be a life-saving professional that goes out into negative 15-degree weather and fixes people's femurs. We think you probably care enough to not spread COVID-19 across Vermont.
One clarification for Secretary Moore. Are middle schools included or excluded, and if excluded, why not equal treatment for them?
No, middle schools are included under the school-based sports guidance. Also understanding that in some communities, elementary and middle school programs are run through recreation departments as opposed to being administered by school districts. The recreational sports guidance specifically speaks to recreational sports programs that take place in a school building.
Thank you very much, all of you. Thank you.
Tom, VT Digger. Tom, VT Digger. All right, we're going to move to Ed, Newport Daily Express. Ed, Newport Daily Express. Okay, we'll move to Alan, the Vermont Standard. Alan, *6 to unmute. All right. Wondering if anybody's here. Dana, local 22. Andrew, Caledonian Record.
Yes, I'm here. Looks like I've got plenty of time for questions.
The gold star for unmuting.
Very good. Well, I have a quick one for Secretary Moore, if I could. I know that with the sports guidance, you've tried to have recreational guidance be in line with the school-based guidance. I'm particularly interested in spectators at indoor events. Are you going to adjust the recreational guidance to eliminate the ability of people to watch indoor youth sports games?
So the recreational sports guidance, an updated version of that was released a week ago Monday, and it includes restrictions on spectators as well. It's slightly less restrictive than the school-based sports guidance, in part because schools under the Agency of Education Safe and Healthy Restart document are discouraged from allowing any visitors into their school buildings. So the recreational sports guidance provides for one adult or one family member to accompany a child or children participating in a sports activity. It discourages that to the extent possible, but does make that allowance. And again, there is that connection where it recognizes to the extent school facilities are being used for recreational sports programs, that the recreational sports program will need to follow the school-based guidance.
Okay, so you envision that one parent per child staying in effect, at least for the time being, for the recreational sports?
Correct, and just to be clear, it's one parent per family, so that if there was a parent with more than one child participating, it would still be one adult, even for those multiple children.
Okay, and then a couple of questions for Dr. Levine. Heading into cold season, and I know anecdotally that there's more symptoms floating around in the community, sniffles and the occasional cough. I'm wondering, what is the guidance for when people should reach out to their primary health care provider and contemplate a test? Is any single symptom enough to do that, or are there parameters that people should still follow?
Well, that's a great question, because as you know, when you look at the list of potential symptoms one can have from COVID, there's a lot of overlap with a whole bunch of winter illnesses. We have a pretty low threshold at this point in time for having a test, especially if it really involves somebody not able to go to a work site and they have no other way to work other than to be present physically there. It's often a judgment call. So it would be the same kind of call you would make to your healthcare provider regarding your symptoms, just questioning what should I do, and see if the response is you should get a COVID test versus why don't you take this allergy medicine because it sounds like you're having a flare-up of your respiratory allergies. So it's individualized, but I would just seek the appropriate guidance for that.
And is there any differentiation between symptoms with adults versus symptoms with kids? I mean, I know schools require if you're symptomatic that you don't attend in person, but say you've got a little one home because they've got a runny nose, should you just wait out that runny nose, or should you think about going to your pediatrician and requesting a test?
Right. So there is guidance in our school guidance and what we've given with the pediatrics community that has to do with symptoms just like you mentioned, some of which can be watched for a day or two versus get a COVID test necessarily for that child. Some of it still has to do with what we're seeing in the specific community that the child is present in, whether it's the school community or the greater community around them, and what their pediatrician is experiencing in terms of the patients that they've been seeing. So it's again going to be up to judgment, but we do have guidance out there in both areas to make sure that people understand that the first day of a runny nose does not necessarily mean every young child is sent for a COVID test, and there's flexibility in that guidance. But again, not being so flexible that we're going to just miss cases that could be important to the classmates in that school. So always being erring on the side of doing more, not less.
Okay, I guess just for general purpose guidance, if you have symptoms, one or two from the list that last more than a day or two, is that the point where you should start calling your primary health care provider?
For an adult you're referring to predominantly?
Not about both. It seems like we have plenty of time, so.
So the answer is probably yes. If you've got a couple of symptoms that could be COVID symptoms, you're already symptomatic, so that would be the ideal time to get tested. So I would definitely suggest that at that point.
And what's the average turnaround time for a test? I've heard from one person who traveled and got the 7th day test, it's now been 5 days and they're still waiting on getting their responses. Is that typical, or?
Yeah, the latest data that we have is still, I think, a maximum of 48 hours. And that's across, I believe, 5 laboratories, both in-state and out-state. But that, again, may not account for every place that a test is sent. So that individual may have had a bad experience, but we've been actually tracking this and feeling quite positive.
And the 48 hours, does that account for the majority of tests that are administered in the state? Or
Yes.
is it different between the pop-ups and state-run versus getting it at, say, a hospital or a healthcare provider?
Now, that accounts for the majority of tests, including the ones run in the state lab, the ones run in conjunction with UVM Medical Center, the ones sent to Broad, and the ones sent to several of the commercial laboratories. And I've just been handed some extra data. It also includes Dartmouth and some of our hospitals within the state who do their own testing. So the turnaround has been pretty uniformly on target. Sorry the person you are aware of did not have such a good experience.
Okay. I guess that's all the time I can burn. Thank you, everyone.
All right, I think that concludes everybody in the queue.
I'm told that concludes the number of questioners. Thank you all. I know we all looked really good today, but we will definitely have the governor back on Friday.